Hello viewers, this is second part of ANDROCARE Connect program this week. This week we have so many questions, so many comments. So we will try to make at least 3 to 4 videos of this. So one more question is, you only mentioned the procedure of the penile Doppler test, but you must do it elaborately by mentioning the values of PSV, EDV and its ideal range and venous insufficiency values. This video of yours is incomplete. See, now when I do a video or when I do a presentation for doctors, whenever I give a lecture in any conference, I mention those things. That is, there I have to educate the doctors on these values. But if I start doing the EDVs and PSV, EDV, then see, you may like regarding that, but most of the people they didn't understand what is PSV, what is EDV. Unnecessarily they'll start looking into that, and it creates too many doubts for them. So what we say is basically what is normal, what is abnormal, whether your report says normal or abnormal, whether there is damage or not. That is what a common people should know. If you are a doctor and if you want to understand how penile Doppler is done, then I have to give a detailed thing. Otherwise, if you can Google, there are so many papers, published papers on penile Doppler study. But for normal people, I don't think this is interesting, or they don't even look for all these things. So does natural erection come after penile implant surgery due to venous leak? See, after penile implant, it's not natural erection. It's only artificial erection because of the implant. So you won't have any natural erection, and that too it will be a cold erection. It won't be a warm erection. And question is, what is cystitis with BOO? Let's see. Cystitis means infection of the bladder wall, urinary bladder wall. If there is infection, chronic infection, we call it as cystitis. So if there is infection in the prostate, we are calling prostatitis. So if there is infection in the epididymis, we are calling as epididymitis. So similar way, if there is infection in the urinary bladder inner wall, we call it as cystitis. So BOO means bladder outlet obstruction. That means urine, there is some obstruction in the urine passage. So that is called BOO. LUTS means, LUTS means lower urinary tract symptoms. Lower urinary tract symptoms means urgency, hesitancy, frequency of urine, sometimes incontinence, few drops of urine will come out, that is called urge incontinence. So these are called lower urinary tract symptoms. Anesthesia delay spray for PE is effect on sperm, please. Generally these sprays or gels which we use for premature ejaculation, generally they have to be, if you are trying for pregnancy, better to stay away from these creams or gels. If gels, what advantage with the gel is, or even this spray, you can use it at least 20 to 30 minutes before intercourse. You leave the spray for 5 to 10 minutes and then wash the penis, and then you can have intercourse. Otherwise, directly having intercourse may affect the sperm, so that it may delay your pregnancy chances. Is anesthesia needed for prostate massage? Not necessary. We give local anesthesia, local anesthetic gel. We use local anesthetic gel and then we do prostate massage.